Thank you very much. Good afternoon. I'm Andre Bissett. I'm the Chief Commercial Officer for Enso, and I'd like to introduce you today of a new concept for pain relief without compromise. Chronic back pain in the workplace is a major unmet need. After the common cold, back pain is the most frequent reason, second most common reason why somebody misses work, lost productivity, and it accounts for almost 25% of all workers' comp claims. 29% of Americans, adult Americans, are suffering in some form of chronic pain. They therefore have 51% of them have no control or feel like they have lost control because of their pain. It affects their lives. It affects their productivity. It affects their ability to get out in life. This really takes a toll on employers' payrolls. 11% is lost due to absenteeism and lost productivity. Now you take all that together and we're looking at billions and billions, hundreds of billions of dollars. So if you look at combining what it costs to take care of these patients on the healthcare side and then what's lost from the employers in productivity, it's upwards of $635 billion in the United States every year. So I'd like to introduce you to Enso, the first viable solution for chronic pain management. What we have is the first non-invasive neuromodulation as our core technology. It is a wearable technology. It delivers what a surgical implanted spinal cord stimulator can do, but non-invasively and across the skin via a wearable, as you see here. This wearable is internet connected, smartphone, to our database. We generate direct live data feed from our users, our wearers, that allows us to have analytics to be able to help these patients. And we have a direct feed and a direct communication with them. With that, we also have compliance, and we're able to see how they use the product and how they're going through their course and recover and dealing with their chronic pain. And we help them return to work. So we got together with our medical advisors, including Bill Brose, one of the founders of the pain clinic at Stanford, Steve Feinberg, the Chronic Pain Association, Wade Aubrey, formerly with Blue Cross CMS, Cheryl Pegas, who is the Chief Medical Officer for Walgreens and Aetna, and Dr. Amadou Fan, who's one of the leaders in this space for neuromodulation. And they advised us to do a randomized controlled trial and figure out what this does clinically with patients. And so we did. And currently we're underway with a multi-center, double-blinded, sham-controlled trial. We have 6 centers. University of California, San Francisco is our PI. And preliminary results have been very promising. We've looked at clinical outcomes and seen statistically significant results across the board from pain reduction using a numerical pain score, saw dramatic improvements, functional improvements. This is the first time people have been able to actually see a chronic pain patient and measure their functional improvement. We've done 2 tests. One is a timed up and go test and a 6-minute walking test, and again, statistically significant. And then one is about quality of life, make sure these patients are feeling better so that they can go back to work and they're empowered. And again, looking at medication reduction. I'd like to show you what this looks like with an actual patient. If I can run the film. This is one of our study patients. This is day 1. You can see he's limping. He's in a lot of pain. You can see his face with a grimace. And this is that simple test of a timed up and go. Now, 4 weeks in our program, using our device, along with our program that I'll talk about in a minute. This is 4 weeks later. You can see his stride, his speed, his position. He no longer has the limp. He had about a 40% improvement in his functional score. So today I'm introducing the Enso Health and Wellness Program. And again, this is a combination of this new, novel, proprietary, non-invasive neuromodulation combined with interactive coaching, monitoring, and support. And again, it's done through our internet-connected device to the app, to our database, and our coaches are empowered to work with these patients through their process and journey through breaking the cycle of pain. Management team is experienced. Sean is our founder, the creator of this technology. Myself and Steve, we come from the med tech side. Tan and Alex, our chief scientific officer, come from more of the consumer tech side. So we have a good balance for both the healthcare and the consumer tech side. So we as a team are interested in progress, not promises. And so our ask today is to partner with somebody to develop the economic outcomes, to do a pilot to look at what this could mean to the bottom line of an employer's spreadsheet, to see at the end of this, use our program, we can help save money, we can help you, but we need a partner for that. And we would like to ask anyone that's interested in this space to work with us on that. And also a second ask is we are currently raising our Series A, if anyone's interested in investing in this very important space, I'd be glad to speak with you about that. So again, Andre Bissett, Chief Commercial Officer, introducing Enso, pain relief without compromise. Thank you.